Welcome. I'm Dr. Dipanjana Datta. I am a genetic counselor with 14 years of experience. Today, I will be talking about Down syndrome. Now, what exactly is Down syndrome? All of us human beings, we have 46 chromosomes which are in pairs, so we have 23 pairs of chromosomes. Of these 23 pairs, one pair determines the sex and they are called the sex chromosomes. While 1 to 22 pairs are present both in the male and the female, and they have genes which are responsible for the normal functioning of the body. See, for example, that if we go to a school and we are given roll numbers, similarly these chromosomes from 1 to 22 are numbered. Individuals who have Down syndrome have an extra copy of chromosome 21 or a partial copy of chromosome 21 which is extra, as a result of which the genes on those chromosomes are extra, giving rise to the condition which we know as Down syndrome. The incidence of Down syndrome in the population is about 1 in 600. Why does this happen? Do we have any kind of family background for this to happen? Well, the answer is quite simple. About 95% of the cases of Down syndrome occur spontaneously. They occur due to a process called Nondisjunction, where the eggs and the sperms might have an abnormal copy which results in an extra chromosome 21 in the fetus, giving rise to Down syndrome. The other thing that can also happen is where a chromosome 21 piggybacks on some other chromosome. This type of Down syndrome is known as a translocation Down syndrome. In such a case, what happens is that this might have been inherited from a parent. And sometimes parents might have what we call as a balanced translocation, and in such cases, these individuals might have an increased chance of having children who have Down syndrome. The other kind of Down syndrome which is found is known as Mosaicism. This means this individual have two kind of cells. One cells with 46 chromosomes, the other cell with about 47 chromosomes. So these individuals have varying degree of severity of the conditions which I had spoken earlier. Now, the incidence of Down syndrome in the general population is about 1 in 600. Is there any way to cure Down syndrome? No, but is there any way where we can understand whether a fetus or a child is affected with Down syndrome before the child is born? The answer is yes. There are a number of prenatal screens which are available which helps to understand whether the fetus has this condition or not. The initial screen is done through an ultrasound as well as a maternal blood test where certain hormones are tested. If a risk is found in these investigations, then we can move on to something which is more concrete or some more invasive methods, wherein we can take the amniotic fluid or a chorionic villi sample from the baby or the placenta, and then we can test it for these chromosomal abnormalities. Then it would depend on the couple as to whether the couple wants to proceed with the pregnancy or they want to terminate it. This particular investigations can be done as early as 12 weeks of the pregnancy, and this can give us a definitive result as in whether the child is affected or not. But understand that sometimes there are what we call as the false negatives, which means the sensitivity of these tests are restricted. The screening test, especially the ultrasound and the maternal screen, are restricted to about 95%, which means there might be those cases where we miss detecting these Down syndrome in the child. Once a child is born with Down syndrome, there are certain management guidelines that are need to be followed. The American Association of Pediatrics has a Down syndrome checklist from birth till the adolescent period to be followed, and these needs to be discussed with your genetic counselor as well as your pediatrician. There are number of standard of care procedures which are need to be done, and follow-ups need to be done for your child. These follow-ups include a CBC count, a thyroid test, a blood sugar test, hearing evaluation, ophthalmological evaluation, along with an early intervention starting like a physiotherapy or an occupational therapy. Very important for all children who are affected with Down syndrome is a cardiac evaluation, because very often a cardiac problem is missed in ultrasound, which might be present at birth, and this might be fatal for the child if not intervened. Life with Down syndrome. These kids who are growing up with the condition of Down syndrome have delayed milestones, but early intervention does help in lowering down these milestones. The growth of these children would be on a different scale, and these expectations need to be discussed with the parents. The pediatrician or your genetic counselor will be helping you in understanding the milestones your child achieves. Speech is a problem with the Down syndrome affected children, and hence swallowing and speech therapy needs to be started pretty early for these children. If the initial cardiac screen and the other abnormalities or anomalies are not there, then life with Down syndrome is possible. There are individuals as old as 72 years living in India, and they are capable of even conducting themselves and working out their own life. So individuals with Down syndrome right now do have the ability to live if given the perfect opportunity or if given the support from their families. Can individuals with Down syndrome have babies? Yes, they can have babies. There is report of infertility with Down syndrome with the male population, but then very little is known, and hence this is probably not the correct information. Thank you for watching this video. If you have any comments or queries, please put them in the comment box below and we will answer. For more such videos, please subscribe to Medical Information Clear, and see you next time.